am going to speak in English today, which should be an improvement for those of you who joined the previous webinar where I attempted to speak Spanish after not having practiced for many years. But so I will move quite quickly through the first sort of 7 or 8 slides, as a lot of this is kind of background and I would think should be known to you to some extent. And I know we covered it in the previous call, but just as sort of a quick recap as the slides get loaded here, if we could go to the first slide, just as a reminder that, you know, the ACT Accelerator's ultimate goal is to reduce mortality and serious disease through equitable allocation of COVID tools that are either new and novel or pre-existing, and to accelerate the end of the health and economic crisis of COVID-19 that has been with us now for over 2 years. The next slide shows you a lovely little diagram and shows you the official language about ACT-A, which is not officially a new decision-making body, but is instead intended to be a space for collaboration. Although I would say over the last few years, we've realized that unofficially it has become this sort of de facto global actor with unclear governance and accountability with tremendous influence, and where decisions have long-ranging implications. And so this sort of set up as a non-decision-making body, but with this kind of influential actors, this has made for a lot of issues of governance, accountability, and transparency. The next slide shows essentially the main setup of the ACT-A, which are the 4 main pillars of diagnostics, therapeutics, and vaccines, as well as the health systems and responses connector and the facilitation council, which acts as sort of a, I don't know, like a high-level body for the ACT-A, and where you see a lot of governments, especially high-income government. Is that me, or is that something with the audio? Is it okay to continue?
Yes, so. Continue. Please.
Okay, thanks. Sorry, I just heard a little bit of background noise. So the next slide sort of shows how we as civil society and community groups have tried to sort of create a platform for collaboration, which is co-led by the Global Fund Advocates Network, which I work with, Stop AIDS, and Wacky Health, where we are meant to try and mirror and fully integrate participation of community and civil society representatives within ACT-A and across sort of all of its bodies, which can be like working groups or work streams or temporary sort of initiatives. I think that the next slide shows a little bit more clarity about who we are as a platform, but you can get information on our website about sort of who are the specific representatives and leads within each of those pillars. And on the next slide, you'll see, I believe, a preview image of what our new website is going to look like, which is going to be launched in the next couple of days, where hopefully you'll be able to go to and find a lot of different information that's useful and sign up for our listserv and those kinds of things. But essentially, the goal of this is a space for all of the civil society and community representatives to collaborate and jointly plan activities and statements and get input from each other to track key issues that are sort of being raised across the whole ACT-A itself. So the next slide shows us just a few
Excuse me, Katie.
Yeah.
Sorry to interrupt you, but can you speak a bit lower? Slower? Sorry for that, translator.
Sorry.
No, slower.
Slower. Yes, I can do that. I'm sorry. Of course I can. So on slide number 7, apologies to the translator. On slide number 7, you can see who makes up the project that is this platform in terms of our name. So I mentioned before the 3 co-lead organizations, and we are supported by a tremendous team that's composed of a project lead and coordinator, Courtney and Revati, who are both on the call today, and a number of incredible individuals who act as focal points within each of the pillars to support the reps that are there. It took us a long time to get funding for those positions, but we've had them in place for about 9 months now, and I can tell you that in terms of the volume of work and what we're able to do, including these kinds of things like these webinars, it makes a tremendous difference in terms of our ability to try and meet the goal of being a platform for the representatives in ACT-A. So slide number 8 just gives you a overview of what the strategic priorities are in 2022 for ACT A. These were established for this year during a process that was led through the July, August, September period of 2021 and launched in October of last year. And generally speaking, we felt we were, engaged and included in the process. There were focus groups, there were other opportunities to provide written input, but ultimately the framing of this review did not really allow us to address some of the larger accountability, transparency, and meaningful inclusion issues in a substantive way within the review discussions. And so while a lot of these, objectives of the ACT A are ones that we can get behind as civil society and communities, the devil is kind of always in the details, and the details are, still kind of in short supply in within the ACT A. The next slide number 9, shows what we said at the time about the review, and I think a lot of this still holds true, with an important note that we do finally have more sort of progress on the second point around a test and treat strategy. But generally, the review kind of was a lost opportunity to make changes and sort of course correct the ACT A. And we raised a number of these issues, both in the sort of formal review, as well as at the Facilitation Council within pillar discussions, and continued to try and raise these issues that you see here around equity, governance, meaningful engagement, sort of across the various conversations. The next slide number 10, and the one following it, we talk a little bit about some of the updates that we can give you today from the diagnostics pillar. And so, it's just to say that increasing testing capacity and access equity to tests remains really critical in the work of the representatives within the diagnostics pillar. Pricing and regulatory issues and the lengthy delays at the WHO in providing real guidance around antigen RDT use, which we do now have, but took a very long time to get, is needed by so many countries to establish testing programs, have remained very sticky issues for the last year and a half. The impact of these capacity and access equity issues creates bottlenecks that have obvious consequences, right? Those who are already marginalized by health service coverage are even further marginalized and continue to be marginalized when it comes to accessing COVID testing, to know their status and to then hopefully be able to access treatment and or other supports. There have absolutely within this pillar been some really strong positives that have been, that I think are important to note, with the engagement by FIND, who is one of the co-lead agencies within this pillar alongside the Global Fund. And that's in that the work at FIND, the people at FIND have been very active in trying to engage the community and civil society representatives since the beginning. And for example, there have been some surveys, as well as, they did manage to put forward a request for proposals to get money for advocacy support, to support the expansion of improving testing equity through, advocacy efforts and other efforts at the community level. On the next slide, some of the key challenges show some of sort of the, for lack of better words, the sort of ongoing problems with equitable access, which includes, an increased focus on things like genomic sequencing, which is really critical. But what genomic sequencing does is identify variants of concern and is expensive and lab intensive, over prioritizing that over widespread testing and worsening access to testing in LMICs. And so a lot of our work, and we'll see a little bit more of this on the therapeutics update in just a second, but a lot of our work in the platform has been focused on test and treat, establishing something that I think many of you and many of us have come, from the HIV and the TB communities and other infectious disease communities, where knowing your status, right, and being able to access treatment and having that be seamless and integrated is really critical in terms of ensuring that people are well supported through the process of identifying whether or not they are affected or impacted by this disease, in this case, COVID. So moving on to so that's my diagnostics update. Moving on to the therapeutics side, there are a number of reps as well within this pillar, and they continue to focus on getting existing effective products out there and do things like expanding manufacturing capacity, promoting generic competition and affordable pricing to get new therapies once they're proven, once they've gone through their clinical trials and so on, out there. And as I alluded to previously, on the next slide, you can see an image of a piece of work that we did across the diagnostics and the treatment civil society pillars, which we call test and treat. And I think it would be on slide 13. I think somehow we managed to get one slide too far into vaccines, which is a whole other challenge. But, we have a white paper we are about to share, we're about to share sort of a key set of advocacy asks around test and treat, and ways, hopefully, to give sort of some advice through an advocacy briefing about how to ask for and how to advocate, and what some of the things are to advocate in terms of test and treat strategies at the national and subnational levels. And that's been the work of some of our great reps in both the therapeutics and the diagnostics pillars. So you can find that paper on our website, and more resources coming soon around that. We also held a webinar last month about it, and I'll pop in some links. Oh, Courtney's done that for me. Thanks, Courtney. And you can, if you sign up for our listserv, but also keep checking back to that new and improved website that's about to go up and will be a bit easier to navigate. You can keep up on some of the work that we are continuing to do there. And obviously, as it is in so many, conversations, continuing to talk about, manufacturing capacity, the bottlenecks that are there, tech transfer, knowledge transfer remains critical within the therapeutics conversation, and ensuring that as treatments come online, that the conversations around ensuring access are, being held at the highest levels, but that they are also being held at the country level. And so there's still a lot more work to do around that. So we'll move to the next slide, and I'll provide a quick update around vaccines. And this is an area where I personally am not as comfortable, but I'm learning a lot from our reps within the platform on this. So hopefully I do justice to the notes that they shared with me. But overall, the focus for them continues to be to ensure that supply of vaccines is more predictable, it has a longer shelf life, and that we're accountable to the global targets, which we remain sort of woefully behind on, and the bottlenecks that are created by the current supply model, which I'm sure many of you are familiar with. But this model that is primarily focused on donations-based solutions that then lack support is challenging, because supply itself is not becoming as much of or is not remaining as much of a problem as delivery. That phrase that many of you probably hear about, from ports to arms. So getting the vaccine doses to people is become the real challenge, and not the overall supply, because demand for vaccines has started to stagnate globally. And as things like preferences by different, sort of actors for different types of vaccines come into play, for example, nobody wants to use AstraZeneca or Sinopharm anymore. They want Pfizer and they want Johnson & Johnson. And so the overall supply is currently much higher than the demand. And many governments are simply not requesting vaccines from distributors. And so manufacturers are revising their manufacturing targets downwards, which could be challenging if we face a major increase in the future, as it took significant time, as we know, to ramp up manufacturing capacity in the first place. And so our reps are focusing on, trying to maintain focus on needing to have manufacturing capacity and supply frameworks established, for now, but also in the future in preparation for the next pandemic, so that the global supply framework and manufacturing capacity is distributed and ready to sort of be leveraged at any moment. Decreases in health spending over the last 2 years, primarily at the national level, have had a significant impact on routine immunizations as well. And so discussions around a call to action on this have been a part of the vaccine reps discussions lately. I think that I forgot to move us through to the next slide, which was slide number 15, which was also a little bit more about what I was just talking about. But of course, we're going to make all of these slides available to you in English and in Spanish, so you can go back and grab anything that I've missed, so my apologies. But we'll move on now to the next slide, 16, just to give you a quick update around the fourth and final pillar, the health systems and response connector, where the objectives of this space are quite clear, which is to strengthen systems for the long term so that progress is sustained while delivering on access to COVID technologies. Reps within that connector are currently focused on issues around strengthening coordination and promoting harmonized solutions across the ACT-A, as well as promoting increased investment in healthcare workers, and a special focus, as they reminded me, on promoting equity at the domestic level across access to tools, because we do know that, for example, the gendered impacts of COVID, or the impacts, the gendered impacts of COVID have been wide and varied, but that's also true for a number of other sort of groups that we sometimes refer to as key and vulnerable populations or marginalized populations, and that specifically that this work requires more focus and more attention as we continue to try to address the equity and access issues within, for COVID. The next slide, slide 17, just to say that, some of what the reps within this connector are focusing on is, one, finally seems to be movement in terms of real conversation within this connector, which has sort of felt stalled all along since the beginning and has gone through a number of different sort of strategic iterations without any, I hate to say it, but without any real work getting done. And so our reps are really, have been ramping up over these last sort of 3 or 4 months as that work has been ramping up. And they continue to look for opportunities to focus on that country level work, that country level support that's needed to rapidly identify needs and gaps. But this kind of stuff takes time. It takes focus and commitment and investment. And there's just such a lot of variation in terms of capacity and things around multi-stakeholder engagement that's facilitated at the country level. So while country teams are being set up, some of the challenges that remain are to ensure that stakeholders are engaged, especially civil society and communities. And with the trends in funding at the global level being replicated at the country level, there are just sort of so many shifting sort of sands all of the time in terms of making sure that we find, some way to, as I said previously, get those tools from ports to the people, or ports to arms. And just to say that within ACT-A currently, I'm just going to take a sip of water, and hopefully that gives our lovely translator a second to catch up. But within the ACT-A currently, there is no formal space for long COVID issues. There isn't a long COVID a specific working group or work stream, although it's, mentioned and dealt with within a number of spaces. But as a platform, we continue to try to engage people living with long COVID, and we're focused on trying to advocate for clinical and other guidance within ACT-A that's needed to inform how governments and health systems identify and support people living with long COVID. And you'll see soon from us at the platform, a sort of call for expressions of interest for an advisory group that we're setting up with some of the existing community reps we have within the platform to join us within the platform and help us define sort of a piece of work over the next few months and define some of the movement or the advocacy that we need around long COVID at the global sort of ACT-A level. So that should be coming out very soon. The next slide is the last slide, and we'll move to sort of Q&A. But just to say that these are all the places where you can find us, and it's clear to us at the moment that there's likely a need for ACT Day to continue beyond its current September expiration date, but it's also clear that by itself, as it is currently set up, it's not a model to be emulated in the future, but rather one to be strongly learnt from and improved upon. So over the coming months, we're focused on many of these different issues within the different pillars that I raised today, but also to looking at the continuation of ACT Day and ensuring that the lessons and the perspectives that are learned in the platform are applied in the various conversations and contexts about what comes next for ACT Day, but also what comes next in the broader sort of pandemic preparedness and response conversations that are taking place globally. I hope I haven't terribly overspoken and not left enough time for conversation, but that's it from me. Thank you. Thank you for inviting me today, and I hope this was a helpful update.
Gracias, Katie. Thank you, Katie. Mira, primera mano levantada. Ahorita vamos a pasar a...
Now we will move on to a 10 minutes Q&A session or any other comment. So here we have several representatives of the ACT A representatives. Not only Katie is here, so they can answer also to your questions. So the first hand raised is from Mr. Jorge Saavedra. Can I do the question in Spanish? Yes, we have translation, so you can do it in English or in Spanish. Okay, then, so thank you very much for this presentation. It's amazing. So I have two questions. You mentioned that this is genomic sequence. You spoke about this genetic sequence and you say that it is complex because it is expensive and because also you needed that it needs a lot of labor intense. It's need a lot of labor. However, it is crucial to do the epidemiological monitoring of all those variants. Otherwise, it's not possible because when we have those variants, you get to know even 2 or 3 months afterwards, once that the chaos is already there in our countries. So I do believe and I think that that should be like a requirement, or you need to define that for those countries, or not wait until the countries ask for it, not only for the relevance for each country, but also at a worldwide level. And that is my first comment. So, and the second one is that with all these resources, ACT-A resources, Latin America, because of COVID-19, has been the most affected region with more diseases around the world, and we're with most with higher infections if you adjust it as in percentage levels. However, it is not the region that gets more support. So this definition about support and resources for those for the regions, have you considered primarily the epidemiology or the level of poverty in the country? How was it defined? Because there were many countries that were not having that levels of diseases, such as Mexico, Brazil, Argentina. Compared with them, they have higher levels of diseased people, but they didn't receive excessive resources. Neither to say that, I mean, the World Bank says that they fit in one economic situation. It didn't impacted the epidemiology, and it was based on the perceived economic situation. So that is another question, because I do not believe that the resources for these countries, for these, I don't believe that they follow the epidemiological factors, but they perceive the economic factors, no, rather than saying that I have so many people and so many friends and family members that passed away. But as for resources to these countries, we didn't get those. So thank you so much.
Gracias, Jorge.
Thank you so much for your question. I don't know if someone else or if one of the representatives of the ACT A would like to answer. Javier, would you like to answer? Yes, well, I'm not a representative of ACT A now, but I do believe to the World Bank board, and it is important to link here this great presentation that Katie has given. Sometimes to explain XA is as explaining an alien that lands in in the country, and I think that Katie did a great job with this, with her capacity and with her patience. She has given us a very eloquent description, and for all of us it is truly important, for those who are in Latin America, for those who have not been exposed to all these tools to facilitate COVID at a global level, and so they can have a better idea, and they can have these webinars. So that is truly important. So being said that, I can just give an example, and this is not the only and a unique example. The mechanism that the Global Fund has launched with together with these emergency resources and two additional resources also with the C19RM. So answering to Jorge's question, let's start from the basis as Latin American citizens that we can also suggest or think that we have been abused based on our income level, and for being considered based on different conditions for different factors. As for the C19RM, the Global Fund has given in order to reassign those resources that were already assigned, let's say in Ecuador, Peru, Guatemala, El Salvador, or any other country, to reassign those funds as an emergency fund, and besides that also giving additional funds to that. It was done based on a formula, and the formula sometimes might be prejudiced for us, no, might not be good for all of us. But one of the mechanisms that I consider that has released resources to based on the demand that all the countries had prioritized, in my subjective opinion, is the C19RM, either this flexibility format of emergency as well as additional formats, as additional resources. The only way to do it in an equitative way was to define this formula. That is to say, let's say a percentage given based in the investment on the global fund for these three diseases in that country. And of course, as you may imagine, Jorge, when you apply a formula, if you receive less amount of money, you might have less amount of money for COVID. So what I do believe and what I do think is that also being participated also in CITA to see all the answers from all the countries, I think that there are some issues that several countries submitted because they participated, civil society participated in the C19RM initiative, and they participated more fast, and they included civil society. They also asked for several personal protective equipment. So I stop here my comment, but I just wanted to mention this resource assignation that was completely transparent through this formula with a global fund with the C19RM initiative. Maybe, as Katie said, for COVID, we might need 5 hours to speak about that, and yet we weren't able to decipher it, to deploy it. Thank you, Javier. Thank you, Javier and Jorge. Thank you for your participation and comments. So, as I see that there are not hands raised, Katie, go ahead, please.
Yeah, no, thank you, Javier, and thank you, Jorge. I think the challenge with ACT-A and why we do still always start with defining for you what it is that it was not intended, and it is not in and of itself the space by which the world expected to support country level work to get these tools to people. The primary function of COVAX and the primary function of FIND within the diagnostics pillar is to bring the price of vaccines down and provide a global pooled kind of procurement supply process, and to affect the sort of supply chains and those kinds of things with the funding that they received. And so while I think that we have moved to understanding that we can do those things over here, but without making sure that we're supporting countries to actually utilize the tools, providing the right guidance, clinical guidance for long COVID or testing guidelines for rapid antigen tests, then that is the other side of the equity coin, right? Like, you have to be able to address both of those, and we're not addressing both of those equally. We're not even actually doing a good job at addressing the equity issue from a supply perspective. But and so the reason I say that is because, to clarify my comments around the genomic sequencing and the genomic surveillance, of course that's important, right? Like, I'm not saying it's not important. When you have limited funds and you're spending your money on identifying doing genomic sequencing, as opposed to like a broader based testing strategy that could be linked to treatment and or isolation supports or whatever it might be that's relevant, what you're doing is you're kind of only addressing one small part of it. And maybe the more impactful thing is to at least ensure that we have broader testing so that we understand the full sort of impact and the full sort of presence of COVID in our communities, as opposed to what I personally see as far more beneficial to people living in countries like mine, which is where we are identifying what variants are out there so that we can get access to better guidance, better vaccines that are, when half the world still hasn't even gotten a first dose, right? And half of the world and more don't have access to testing within their communities. And so when it comes to an equity issue, it's just, there's different sides of the coin. ACT-A was created for one, but is coming to the realization that the other is critically important in the broader equity issues. And there's so much more work to do. But just to clarify that, of course, genomic sequencing, Jorge, is really critically important, but it's not important in the absence of a broad-based testing strategy or a test and treat strategy in countries. Thanks.
Thank you, Katie, for answering Jorge's questions. Gracias, Katie. Y viendo...
So, based on the time also, I would like to follow the agenda, and now let's talk about the priorities from the population, and that's the presentation and the priorities from civil society and the communities based on the survey that we spread several days ago. So this will be presented by Lidice. She is the coordinator of HIV 2025, and this will be also supported by Javier Urcade. Thank you so much, Keren. Thank you, Katie, for your presentation, for this introduction. So, this presentation has the answers from some people that participated in this survey. This was a dialogue space as well as a communication space and discussion space for the priorities in Latin America and the Caribbean region. So we can send ACT-A these outcomes. So for that, we consider truly important to start from this survey. Within the region, right now, we are facing, let's say that this calm process, all the countries from Mexico up to Argentina, moving through Costa Rica, Peru, Uruguay, we're just facing this calm space, and there are just a few cases, and there are just a few numbers on deceased people, and the vaccinated people are increasing, although we still have half of the countries that yet haven't reached the 70% of vaccination, of full doses. So within this context, the priorities that we had identified in this dynamic that still the pandemic has not been finished, has not ended, we face several challenges from the civil society. Still, the access to diagnostic tests is limited, and it is limited and is expensive. Not all the countries have like this spread network on different testings at the first level of Baker, but only with this focus group, and that limits this fast diagnosis. Not all the countries have enough resources so they can reach all the communities, despite this cultural barrier that some countries also have. As Jorge was saying in his comment also, there is a limited attention towards Latin America. We were just part of the news until last year, where we have higher level numbers of deceased people. But in terms of financing and in terms of calling the attention of the region, that has decreased, despite this situation is facing several crises in Latin America. So another point that is considered as another challenge based on the responses of this survey was the corruption levels in the health system in different countries. And then priorities for these testings are linked to these challenges. This easy use of the testing we need to have access. So many governments have opened this availability through drugstores. In here, they have a cost of $5, and for these home test antigen testings, it has to be guaranteed, or we will need to work to guarantee this universal coverage on having this equity with regards of the testings, and also to fight corruption and to fight this intercultural with indigenous groups is key. And that is mentioned not only with the testing but also with treatment as well as vaccination, where we had identified several problems, serious problems with within different countries. And fighting corruption, of course, well, in that sense, that is related to all the factors that are related with health education matters, but it was shown in this survey. As for the treatment, as for the challenges regarding treatment, fortunately, with the appearance of the new variants, the problem of access to oxygen is no longer a priority. Most of the countries have able to develop these oxygen plants or to buy oxygen among the countries. They managed to do so. But just a few countries have access to this treatment means on new development. Today in the morning we have this news that the World Health Organization has launched these new health recommendations for the use of Paxlovid. It is used now in some other countries such as molnupiravir, but there is a limited access, prices are high, and there is no production, there is no generic production available for the region. So with regards of the priorities for treatment, in that sense, we can say that it is needed. Besides diagnosis, we also need a timely treatment, a sustained treatment for all those who need it. And it was also mentioned, some people mentioned in the survey that they spoke about the possibility and the need of opening and having access to treatment outside the public health institutions, always following clear protocols, treatment protocols and care protocols, so they can guarantee a better recovery, and all of these based also in evidence. Another priority is being able to get all the records of antivirals that are already tested and that they are safe and secure, available at a global level, and being able to trade them at a fair price. And something that Katie also mentioned at the beginning of her presentation, and this is linked together with those actions of these voluntary or mandatory licenses, so we can have fair access to fair prices. And this is also linked to the possibility of being able to transfer technology for these innovative producers to guarantee local production and also to guarantee access to this medication in our countries. There are also some other initiatives within the region that we are giving a follow-up. It was mentioned in this survey in order to debate about the patent request, as well as to make transparent the expenses of medication and try to avoid corruption, which is a recurrent topic in our countries. As for the challenges with regards of vaccinations, I was saying that even though we're moving forward and every week we have more progress with regards of the vaccination in our countries, we are still having a lot of prejudices and a lot of myths besides vaccinations. And also we have these cultural barriers that are related with the fact that it is denied within the cultures of some of the groups. It is denied, and we just look to have these mass media campaigns from the cities, from big cities, not including this cosmovision from indigenous communities and peoples, so they can be included in these communication strategies and so from different from our countries in Latin America. So I don't know if Peru is an example that can be highlighted on as an example of the bad communication that we have for vaccination. But in general, we had as a result of this survey, we know that the communication from the health ministers had been really limited on with regards to the promotion of vaccination. So in that sense, something else has to be done. A more sustained and intercultural work has to be done, and in that sense, that will make the communities and the peoples to own this issue. And besides the evidence that it is already there, I was giving this image saying, get vaccinated today, because there are several studies now that show that this image of the syringe makes people reject vaccination and makes people reject these campaigns. But in all our countries, we have this image. So the communication aspect here has been highlighted in this survey. There has to be also a more awareness work for individuals, so having this intercultural communication within all the vaccination programs. Vaccines should be available in all the territories, having this equitable access. And something that it is it sounds like a goal, but we need to reach the 90% of the vaccination in all the countries and for all those who are there. Something else that was discussed in the meetings last week was that we need to consider and we need to start discussing and we need to try in integrating COVID vaccination within the national plans, within the national vaccination plans of the countries. So that way, then we can guarantee COVID elimination in the near future. And of course, again, it appears here this idea of fighting corruption and guarantee local production of vaccines. So those were some of the outcomes that we have based in this survey. I think that this could be considered as a starting point for this dialogue. So now I give the floor to Javier. Thank you, Lidice. Thank you everyone. Thank you to all the participants who answered this survey. It was also interesting for us to do this meta-analysis with different dialogues and conversations and discussions that we have in several spaces. So I just wanted to highlight here the the WhatsApp group that we have, that it is guided by Luzma and Richard Stern. I think that this has been one of the great contributions, so we can have a better communication, so information flows properly on what was going on in the world, what was going on also in the region, and what was going on with everyone. This was a space where everyone was able to discuss and to speak about their doubts and questions about vaccines, and when they have not as an activist. I think that this is a model, this is an example that we can follow. There are several mechanisms in other countries with CRG platform and so other organizations. They have worked with that. They have worked in specific issues on communication. But I think that the construction of a community has this value added. So, and not only for sharing knowledge, but also to create this not only at an individual level, so we can cover that, and that's what I wanted to highlight. So hopefully we can develop similar spaces for any other problem that we will face in the near future with regards of health matters. As Lidice was was saying, there's an issue about the cosmovision and the mindset and the different belief systems that always, with regards of public health issues, are not taken into consideration. There are just a few instances that are considered. So, some other colleagues here that they are present, we have discussed access to health, to universal access for people with disabilities, and and we spoke about each one of the disabilities. How is it that we can develop a workshop for people that is friendly for those who need a signal language? So imagine that in the world and in Latin America, for those who have this type of disability or any other who live with a different disability, to receive communication with regards of health matters. So, however, switching the information with the OPS, they haven't overcome the 50% of vaccination because they don't have vaccines. As Lily was saying, there are some aspects that, even though culturally, social, and anthropologically speaking, there has been a low acceptance of vaccination. But in most of our countries, there are not vaccines. They are not even for to cover the complete doses of two shots. So going back of what Jorge was speaking about, specifically with genomic monitoring for Latin America and the Caribbean, with regards of testing serology, with testing COVID, it has a low percentage. When we needed to do the testing for people with COVID, there was this political decision not to count the people with COVID because of a political situation, because the benefit cost proposal, and to recommend this. It was important in our countries, and from Argentina to Mexico, the testing rate was very low. And of course, also speaking about different situations, the health ministers had been transformed into COVID health centers, and as such, the follow-up for oncology or diabetes or any other health issue or any other health problem was highly impacted. So the mortality from other health diseases was increased, but this is can only a there are not studies. There are not studies of this diagnosis of oncologic patients, men and women, brought by COVID. We can truly assume that, but obviously with so many studies that were interrupted and stopped, and there are also so many HIV people that do not have access to viral loads also. And the other thing that was also important, and I was reflecting that the last week, and Pedro and his team speaking about the COVID crisis has not finished, despite some of the media said that it is not only for what we're looking at or what we're facing right now in Asia, where there is this whole city that is being isolated, but for low vaccination, there are countries that haven't reached these 2 digits of vaccination. So that is the feedback that we have to these new interests. Moving forward, one of the things that Latin America and the Caribbean face, and maybe because of the language barrier, is that, and I don't want to minimize the work who is here in this call that had participated actively and that have given their great effort to be in this Act A. But what happens to a region that speaks another language is that it is always been not quite represented in those spaces. And even though I have been in some spaces, I've been as representative in the UHC mechanism, in the last of the pillars that is related with health systems, and all the case studies that were discussed in those long meetings were related with some other countries, but not with Latin America. So we need to keep on speaking about that because this is an important issue. But I would like to acknowledge and I would like to recognize for those who are available in this meeting that have given their time and effort on doing and on making Latin America present in the different 8 pillars. As for the access of antivirals, we discussed that with Richard and Luzma, and this is a pending issue, even though Latin America has these mechanisms on purchases with the Health Pan American Organization, and we know that that takes long, and also antiviral access depending on the market also. It is important to understand for those who had reviewed, as my case, several initiatives such as the one of the Global Fund C19RM to fight COVID, even though there were clear proposals, because, well, at least finally we are Latin America, that the communities and the HIV people, and because, well, we're speaking about this initiative of these three diseases, they needed to monitor the additional resources. The assignation was very poor with regards of the masks and the personal protective equipment for those who were working at the health centers. And in reality, the realities I see, Marcela Romelo and some other colleagues, is that the trans organizations and the AMSM organizations become on these centers, but without having these personal protective equipments. So I end with that, my comment, and I insist, how is it that Latin America and the Caribbean, the Spanish-speaking countries, organize themselves by organizing these webinars, and when the importance on the relevance of the discussion of vaccinating HIV communities or not, as my personal opinion, the pandemic hasn't finished, so there's a lot of work that has to be done. Thank you to the platform that guides and leads Stop AIDS, GFAN, and Wacky Health. Thank you for the job that you have done in order to guarantee our participation in Act A. So I finish my comment with